Many people live with high blood sugar for years without realizing it. The problem is that early symptoms are often subtle, and many people ignore them. But recognizing these signs early can help prevent serious complications like heart disease, nerve damage, and vision problems. In this video, we'll go through the early warning signs of high blood sugar, also known as hyperglycemia. Hyperglycemia simply means high blood sugar. Sugar in the blood is called glucose, and it is the body's main source of energy. After we eat, carbohydrates are broken down into glucose and released into the bloodstream. A hormone called insulin helps move this glucose from the blood into the body's cells, where it can be used for energy. But when the body does not produce enough insulin, or cannot use insulin effectively, glucose begins to build up in the bloodstream. This leads to high blood sugar, or hyperglycemia. It is commonly seen in people with diabetes, but it can also occur in people who are developing diabetes and may not yet know it. One of the earliest signs of high blood sugar is increased thirst. When blood sugar levels rise, the body tries to remove excess glucose through the urine. This process pulls water out of the body and can lead to dehydration. As a result, the brain signals that the body needs more fluids. You may notice that you are drinking more water than usual, yet still feel thirsty. Another common symptom is frequent urination, especially at night. When there's too much glucose in the blood, the kidneys try to filter it out. Glucose in the urine draws more water with it, increasing urine production. Some people may notice that they need to go to the bathroom more often than usual, or wake up multiple times during the night to urinate. Persistent fatigue or low energy is another early sign. Even though there is plenty of glucose in the bloodstream, the body's cells cannot use it effectively without enough insulin. This means the cells are not getting the energy they need. As a result, people with high blood sugar may feel tired, weak, or lacking energy, even after rest. High blood sugar can also affect the eyes. When glucose levels rise, fluid shifts can occur in the eye, particularly in the lens. This can temporarily affect how the eye focuses light. As a result, some people may experience blurred or slightly distorted vision. In many cases, vision improves once blood sugar levels return to a normal range. However, long-term uncontrolled diabetes can damage the retina. So, persistent vision changes should always be evaluated by a healthcare professional. Another possible symptom is increased hunger. Even though blood sugar levels are high, the body's cells may not be receiving enough usable energy. The brain may interpret this as a signal that the body needs more food. This can cause people to feel hungry even shortly after eating. Other symptoms of hyperglycemia may include dry mouth, headaches, difficulty concentrating, slow healing of cuts or wounds. These symptoms can develop gradually and may be easy to overlook. If someone experiences several of these symptoms consistently, it may be helpful to check their blood sugar levels. A simple blood test can help determine whether blood sugar levels are within a healthy range. Doctors commonly use tests such as fasting, blood glucose, HbA1c, or sometimes an oral glucose tolerance test to evaluate blood sugar control. Many health organizations, including the World Health Organization and the American Diabetes Association, recommend screening for diabetes in adults, particularly those with risk factors such as obesity, high blood pressure, or a family history of diabetes. For people without diabetes, checking blood sugar every few years may be reasonable. Those with higher risk may benefit from testing once a year. For people who already have diabetes, doctors usually monitor blood sugar more closely, and tests like HbA1c are often repeated every 3 to 6 months to assess long-term blood sugar control. High blood sugar often develops slowly, and the early signs can be easy to miss. But symptoms such as increased thirst, frequent urination, fatigue, blurred vision, and unusual hunger may be your body's warning signals. Recognizing these early signs allows people to seek medical advice, make lifestyle changes, and protect their long-term health. Understanding these signals is an important step toward preventing diabetes and maintaining overall health.